Hello everyone, I'm Simra, psychologist at Tulasi Healthcare. Today we're going to learn about how family members can help a person with suffering from OCD. Okay, let's learn what is OCD. Obsessive compulsive disorder features a persistent pattern of unwanted thoughts and fears which are known as obsessions that leads to repetitive behavior which are known as compulsions. These obsessions and compulsions tend to cause significant distress in your daily living activity. For example, obsessions and compulsions have different theme to them. For example, an obsession would be you have fear of being contaminated. So the compulsion would be you're going and cleaning your hands, your body again and again. Second example would be you forgot that you have turned off the stove. So you will just, the compulsion would be you're going again and again to check if you're turned off the stove or your doors are locked or they're not. People with OCD are generally aware that their compulsions and obsessions are irrational and excessive, yet they are unable to control or resist them. Now let's learn what not to say to a person who has OCD as your loved one. First thing, it's okay, we are all a little bit OCD. This sentence will not make them happy. It is a sentence that is very hurting. So a person is not OCD. OCD is a diagnosis. Second, you are controlling. Everything has to be your own way. So this statement can be very damaging to the person you're saying to. They might feel that you're putting a finger on their personality or they have a character flaw. It is very normal to feel frustrated around someone who has OCD. There are more constructive ways to express your frustration rather than just name calling or criticizing them. Third, you are lucky. I wish I could be more organized like you. No, individuals who have OCD are most definitely not lucky, and they do not feel that their symptoms are helping them in their daily living activities. The OCD symptoms even complex your simple activities. Some of the other statements would be, it's in your head, you just need to relax. Why can't you just stop? So trust me, if they could just stop or relax all by themselves, this would not have been called a mental health condition. Now let's talk about how you and your family can help a person with OCD. First thing first, be informed. Accept that OCD is a mental health condition which is treatable. That is the first step towards the recovery. Second, recognize signals. It is important and crucial for the family members to recognize the warning signs of OCD. People with OCD usually reports that their symptoms get worse when they are criticized or blamed for. So it is important that you as a family member learn what are the warning signs and not take it as a personality trait, because that will help them to combat the problem. Second point is modifying your expectations. Any kind of change can be experienced as stressful, but when there are family conflicts, it fuels the problem and escalates the symptoms. Family conflicts only fuels the fire. They would just say, just snap out of it. You cannot just snap out of it. You need to learn as a family member. You need to be validating, encouraging and supportive towards them. Remember that people get better at their own different rates according to their level of functioning, not that of others. Be slow. Gradual improvements are always better in the longer run if relapse are to be prevented. Create a supportive environment for them. The more you avoid personal criticism, the better. You need to understand about OCD. You don't have to assist them in their compulsive behavior in a normal and equal tone. You need to make them understand that these are their symptoms of OCD and you cannot help them or assist them in the same thing because they are trying to resist them as well. Next point is medication. Don't undermine the medication that you have been prescribed. Learn about their side effects, and if you notice any behavioral change, report back as soon as you can. Keep your communications very clear and very simple. Avoid lengthy explanations about anything. As a family member, you all play a very crucial role in the recovery of a person who is suffering from OCD. Hence, you can motivate them and recognize their early warning signs and motivate them to seek help. Thank you.